Okay, so this is my diagram of the eye and the different parts of the eye. The first part is the choroid. It contains blood vessels and it lines the back of the eye. It is located between the retina and the sclera. The ciliary body is located behind the iris. It is a muscle and it focuses the lens. The cornea, it is the front window of the eye and it transmits and focuses light that comes into the eye. Same with the iris. The iris is the colored part of our eye and it regulates the amount of light that enters the eye. So if there is a bright light, the iris will close the pupil to let in less light. And the same thing, if there's low light, the iris will open the pupil to let in more light. The lens, which is located right here, the lens is transparent and it can be replaced if necessary. Lenses do deteriorate as we age, but it can be corrected with reading glasses. The macula, located in the retina, it has special light-sensitive cells, and it helps us see fine details clearly. There is a disorder called macular degeneration, which basically the macula deteriorates, causing vision loss, and it does happen in older age. The optic nerve, located bottom of the eye to the brain, it carries nerve fibers, and it sends visual messages to the retina, which then send it to the brain. Our pupil, which is up here, it's a dark center opening of the iris. It's in the middle of the iris. The pupil does change size and it adjusts for the amount of light that is going to be entered. So if you're doing an assessment on a patient, you shine a light into their eye, it will dilate and get smaller. And then once you get rid of the light, it'll open back up. The retina, next to the macula, the retina is a nerve lining basically of the back of the eye, and it sends light and creates electrical pulses that are sent from the optic nerve, or to the optic nerve, and then to our brain. The sclera, which is the white outer coat of our eye, and it surrounds the iris. And then the vitreous body is, it's like a clear jelly substance filling that fills the central cavity of the entire eye. Optic disc is located by the optic nerve. It's a round spot found on the retina, and it's formed by passages of axons and other cells. It transfers signals from the photoreceptors of our eye, and it creates, it allows us to see, basically. It sends photoreceptors of the eye to our optic nerve, which is located right next to it, and then helps us see pictures and whatever. The conjunctiva is located on the sides right here. It's the outer portion of the eye, an inner layer of the eyelid. It protects the eye. It also can get infected. If you've heard of conjunctivitis or pink eye, that is the part that does get infected. And then the anterior chamber, it is the front part of the eye between the cornea and the iris. And it also controls the amount of light that enters the eye by opening and closing the pupil. Order out of 3 for adults and children. Strabismus, it is where patients can lose control of their eye movement, affecting the extraocular muscles of the eye. It is when you see the eyes won't look in the same direction. So either the eyes won't move together, or when you're looking at a light or bright sunlight, one eye will squint. Bumping into things, tilting your head to look at an object are all signs of strabismus, but it can be diagnosed by light reflex testing. It evaluates the alignment of the eyes, and it's just by having the patient look directly at a point of light, and the ophthalmologist will be able to tell. Treatment of strabismus is pretty simple. It's either eyeglasses, prisms, vision therapy, or eye muscle surgery, which is an extent condition. You can use patch therapy if it is in a child. Basically, patch therapy is when you cover the stronger eye, allowing the weaker eye to do more than it can at the higher function. And then for a nurse, with a patient with strabismus, I would just manage the anxiety, calm the patient, and ensure them that there are treatments to help this, not necessarily fix it, but can help improve the eye movement. Next in a patient is cataracts, which are very common in older adults and just adults. It's cloudiness in your vision, and it only affects a small part of the lens, and it can cause vision loss. But as the cataract can grow larger, as it does, it clouds more of the lens, and it distorts the light that passes through the lens. Symptoms would be obviously cloudiness, blurred vision, dim vision, increasing difficulty of vision at night, or sensitivity to light and glare. What diagnoses cataracts is just a basic retinal exam. It uses something called a slit lamp exam and a visual acuity test. Treatment for cataracts are surgery. Surgery which it removes, let's say this is an infected lens, it'll remove this lens and then they will put an artificial lens, and it will have to get replaced in a few years. It doesn't last forever. As a nurse caring for a patient with cataracts, it is very common, but just ensuring that they feel safe with the procedure, they attend their eye exams, and wear their contact lenses. Lastly, for adults is glaucoma. Glaucoma is always checked when you have a regular eye exam. It is just a general term group of disorders that affect or damage the optic nerve, which is located in the back of the eye. It is when fluid builds up in the front part of the eye, and it puts pressure on the eye, and it gradually damages the optic nerve. Symptoms people will notice with glaucoma is headaches, low vision, blurred vision. It can affect the stomach, so nausea and vomiting, and also red eyes. How to test for this would be a Telemetry Test, and it just tests the pressure inside your eye. Into that eye exam, they blow just air into the eye for a second, and that will test if there's pressure in the eye. There is only currently one approved treatment for glaucoma, and it is a lower intraocular pressure test. And it can also be achieved by eye drops, lasers, and through surgical intervention. As a nurse helping someone with glaucoma, I would provide the patient safety, always assess their vision when they do come in, educate them on what glaucoma is and how common it is, and the importance of following up with your ophthalmologist. Next, for the 3 disorders of older adults, macular degeneration was one of them, where it affects the macula and it does deteriorate. And macula is in the retina, so it is responsible for clear vision. Over time, the tissue of the macula can thin, and loose cells are responsible for vision. So symptoms of macular degeneration are going to be dark, blurry areas in your eye, or worse or different color perception, or just in general, just loss of vision. The ophthalmologist will use an Amsler grid. It is a test to detect or look at your central vision if there are any defects in it. If you do have macular degeneration, the test will show that some straight lines in the grid will look faded, broken, or disoriented. There are treatments for macular degeneration, such as injections in the eye. There is a newer, improved treatment that you can avoid injections in the eye, and it's called retinal gene therapy. Retinal gene therapy is when the body is injected anti-FEGF. It's by inserting a harmless virus into the eye or into the person, and it goes into the person's DNA. Nurse interventions, just educating them on when they do come for treatment, to wear dark sunglasses, hats, long sleeve shirts, to prevent, or I'll let the patient know to be cautious of avoiding exposure to any direct sunlight, bright lights, 5 days after their treatment. So basically just stay inside. Presbyopia, it's caused by the hardening of the lens of the eye, and this does occur with aging. It's where the lens becomes flexible and it can no longer change the shape to focus on images that are up close. So you'll see people with this disorder, they have a tendency of holding the material farther away from them to make sure to see if the letters are clear. Blurred vision when normal reading distance, or eye strain, headaches. Headaches are a big one that affect the eyes. To test for presbyopia is a basic eye exam, and to correct it for treatment is corrective lenses, contact lenses, surgeries, or you can get lens implants for presbyopia. That's an extreme case. And lastly, it's going to be dry eyes. Dry eyes are very common in older adults. So tears, they protect the surface of the eye from any infections. So without those tears, your eye has an increased risk of infection and damage to the surface of the eye. It also can cause abrasions on the eye or ulcers, or even vision loss. A Strabismus test is used to diagnose a dry eye syndrome. Sounds silly, but this is a condition where the tear glands are just unable to produce enough tears to keep the eyes moist. Treatment for it would be artificial teardrops. What causes stinging, burning, redness in the eye. What dry eyes do, this artificial teardrops will keep the eye moist and protect against infection. Nursing interventions would be teaching the patient how to use eye drops appropriately. If they do have dry eyes, to come in immediately to see their ophthalmologist, and eyeglasses if it does cause loss of vision. And this is my eye diagram.